Hey, Chiropractic Future. I'm here to give my Q1 update. So I started off this term in a systematic review class. So the whole point of it was to go through the entire process of developing an idea, doing the searches, creating the manuscript. So I finished up with that. I hope to have that paper published. We compared alternative payment models and fee-for-service models for the management of low back pain. So it was an interesting topic and some interesting conclusions as well that came from that. I'm planning on presenting at the upcoming APHA conference, and I'm hoping to have that published by this summer, depending on how quickly the publication process happens. So I also went to ACRAC this past month and developed that was my first time there, so I developed some really good connections. I felt like met the other residents, fellows, other chiropractic researchers, so it was great to be there. I have finished up most of my stats heavy courses, so I'm currently still in one, but I feel much more comfortable using, different softwares, different coding programs to conduct statistical analyses. So that's really nice to be able to have a better understanding of that and to actually be able to, conduct some of these common statistical tests and regressions and so on. I'm working on learning R in one of my classes now, so that's a little more tough, I would say, a little more complex than the other one that I was using, which was Stata. But I think there's a more potential maybe in R, better data visualization, just a little more comprehensive of a software. So I'm enjoying trying to learn that program. I'm also writing a manuscript in that class as part of my thesis, where I'm using the global burden of disease epidemiologic data along with socioeconomic status data to look at how low back pain in several different states has changed over time, so over the past 20 or 30 years. I also contributed to a recent Delphi study on the management of tension type headaches and cervicogenic headaches. I'm assisting with peer review of spine-related publications. I'm continuing to see patients at the Spine Center at the hospital for surgical evaluation along with the surgeon for half-day a week. But I will be starting an independent kind of triage role in a few months at that location. So I'm looking forward to that. There's been a lot of really complex cases that come through, obviously, a surgeon's office. So being able to be the first one to see those patients and think about how I would manage them if I was treating them, and being able to look through all their history, their imaging, all the past tests they've had done is a really cool and unique experience, I think. So I'm looking forward to being able to, have that independent clinical role. So that'll be coming up soon. I'm continuing to see patients in our chiropractic clinic that's located at the primary care center, outpatient clinic. So I also recently accepted a student liaison position for the chiropractic healthcare section of the APHA. I haven't officially been accepted yet, but I assume that'll happen, in the next month or two. I'm also going to be working on a few more projects during the summer months, so I'm gonna be very busy. So I'm in the process of starting to work with Stacy Salisbury on a qualitative study that's looking at the provider perceptions of their impact low back pain trial and that protocol that they're implementing. So that should start soon. I think everything has gotten approved, so it's that's starting to come together. I'm also going to be working on another systematic review and guideline as part of the Clinical Compass group. And I recently joined as a research assistant on a study at Dartmouth Hitchcock, the hospital here, for implementation of a protocol designed to reduce surgical site infections in joint and spine surgeries. So that is all for my quarter one and some of kind of the looking into quarter two update for you guys. Thanks.